I had a consult after a couple surgeries today for a patient with breast cancer, and we were discussing Motiva implants and reconstruction. So the patient expressed interest in these implants, and they are currently off label for reconstruction. So why is that? So it doesn't mean they're unsafe in reconstruction. It means that they haven't completed the reconstructive arm of their trial to get FDA approval in the United States. And that should be finishing this year. And hopefully by this time next year, they will be approved. So you can use them and have them as a patient if that's what you want, but it will be off label, just like the Alloderm and just like the mesh that we would potentially use in your surgery. Here's the problem though. So we will not have their full size catalog until they get FDA approval. So if you are a patient that requires a larger implant or wants a larger implant, you may not have an option because right now they go up to 625. And if you need something larger than that, we don't have those on the market for able to be used at all at this point. Once they're approved though, we will have sizes up to 1,050, but that won't be until they get the official recon indication. So I haven't had trouble getting insurance to cover that type of implant with my reconstruction patients, but that is certainly a concern. Some people are worried that their insurance may not cover since there's not an indication for it. I haven't heard about that, but again, it's possible. And the other issue is that some hospitals don't have them on formulary yet because they don't have a recon indication. So you may not have that option even if you want it. So anyway, that's just kind of the roundup on Motiva implants and reconstruction. They certainly can be used. It's considered off-label at this point, and hopefully sometime next year we'll get an on-label indication and they'll be more widely available with all of the sizes.